Thanks, Kathy. And thank you to everybody joining us today. I know there is a lot going on in the city and the community, and so I just really appreciate you being here because COVID-19 has not gone anywhere. So just looking at social media and hearing what people are seeing in the community as we opened, I just really reminded of a traffic jam. So if you drive, you've had the experience of being stuck because of an accident or road work. It's really frustrating being stuck in place, right? I mean, nothing more frustrating than being stuck in traffic, but you get even angry because you can't go where you want to go. But when we get past this problem, people feel unrestrained, and what do? Everyone speeds up a little bit too much. And then in a mile or two, we all get stuck again. So my job as the director of the health department is just really to hold up that big orange sign that says slow. So those of you following mayor's briefings know that I have 4 kids under the age of 6. And so just, I know how frustrating it can be to try to social distance, especially with small kids, getting them to wash their hands, cleaning surfaces they touch, not being able to let them play with friends or go to their favorite places is hard. But if we don't go slow and follow the rules, we could end up on lockdown again, and nobody wants that. So please keep washing your hands, wearing your mask, and when you go out, if you socialize outside of your bubble, do it outside and do it 6 feet apart. So with that, going to get into it. Today we've got some great updates for you. Ray Zhao, our chief epidemiologist, is going to share some data insights. And Karen Handmaker, our executive in charge of contact tracing, is going to share more about how that's going now, and now that we've got our first week behind us. I also have lots of my team on the briefing today who can answer questions that you guys may have. So Bill Altman's our executive leading the COVID-19 testing, T. Gonzalez, our director for the Center for Health Equity, Dr. Kaloya, our medical director, and Nick Hart, who is filling in and stepping up for Connie Mendo to talk about compliance today. So if you have any questions, please make sure to put them in the chat box and we will get to them. So let's start with the data. Daily COVID-19 numbers through June 18th, we have 3,281 confirmed COVID-19 cases here in Louisville. This is 309 new from last week and 44 new from yesterday. In total, we are sadly reporting 196 total deaths from COVID-19 in the community, and this is 7 new from last week and 2 new from yesterday. In the positive, we have 2,580 people that are in recovery from COVID-19 and 596 that are new from last week and 118 new from yesterday. So moving in the right direction, which is exciting to hear. For our first responder and corrections data, today we have 1 new positive test to report. That positive test comes from EMS, and it's the first positive test in weeks among our first responders. Overall, 49 Louisville first responders have tested positive since the crisis began, and as of today, 46 of them are back at work. 3 are recovering at home. For corrections, we've tested 1,305 people in corrections, and 10 have tested positive. We do have 45 tests pending right now today. So with that, I am going to turn it over to Ray and have him share some more in-depth insights of our data. So Ray, what do you have for us today?
Okay, thank you, Dr. Moyer. Is the screen being shared right now? Okay. So on the next slide, we have basically a map of all of our cases broken down by zip code and the rates that is being currently reported out of each of those. Now, we excluded long-term care facilities from these locations, namely because the purpose of this map is to kind of indicate the community spread and not ones that are more likely or localized, I should say, within a facility. So as you can see, the area codes 40214 and 219 in those regions, basically like this kind of little, I guess, along the Watterson Loop, is the most heavily affected right now in our city. And part of that is also due to their own, due to the kind of people living there, and also the I guess the jobs that they take typically. Next slide. This is a very basic epi curve of the outbreak broken down by MMWR week, which is the same kind of timeline that the CDC uses. And the idea here is to kind of show the differences, that the color differences represent hospitalization status. The dark blue represents the number of cases that were reported as being hospitalized, and the light blue ones are the ones who indicate that they haven't reported any hospitalizations associated with COVID-19. And as a result, you can kind of see that there's a very distinctive trend starting from the beginning of this outbreak and really quickly actually for the state of Kentucky and for us as well, that we don't have a large proportion of our COVID-19 cases actually being hospitalized or anything of that sort. And as you can see, week 24, which is the previous week, we really do not have that many cases that are reported from the hospitals or report needing hospital care, which is a good sign for both our healthcare systems and also for our community, and which hopefully means that the number of people who are suffering from COVID-19, the symptoms aren't as severe in them. But there's more analysis that needs to be done in order to reliably make that statement. But it's a good indicator in the sense that our healthcare systems here locally, at least, aren't being overwhelmed. Next slide. In terms of the race and ethnicity breakdown, they have stayed pretty consistent throughout this outbreak after the initial first few weeks. We have 50 among our confirmed cases. We still have 57% white, 31% black, 6% Asian as our three most predominant races that are represented in our cases. Among the deceased population, we still have a similar breakdown as well. In terms of ethnicity, this disparity, or rather this difference between the number of Hispanic and Latino cases that are confirmed and the number and the percentage of deceased cases is something that we're trying to address and kind of assess in terms of why there's this such big difference. We would expect at least a closer difference between the percentages of cases represented, but in any case, it is it's a good disparity to have in the sense that it doesn't seem like our Hispanic Latino populations are dying from the illness, which is always a good sign. Next slide. Okay. So right now our data is still fairly limited, but we're still diving into the data due to our recent transition to the state's case management system. So we're in the process of building out all of the dashboards and everything else that would help both inform the public and also our own response and getting everything back to what we were doing before and having a much better picture.
Well, thanks, Ray. Just a great reminder that COVID is still in every zip code here in Louisville. And those with chronic conditions and are older or at higher risk of severe disease, complications, and even death. So I think we know from other data sets that 75% of our positive cases in Louisville have been in those under 65. And 66% of which had reported no pre-existing medical conditions. We also see cases are growing fastest in our 20 to 44 age group as well. And while these people may experience milder disease, as we see in the hospitalization data that you reported, we do know that they're in contact with family members and friends that could have more severe complications. 82% of our COVID deaths in Louisville are in those over the age of 65. So just the bottom line here is COVID is definitely in our community still, and we all need to be careful. We need to be wearing masks when we're going out, and we need to be washing our hands regularly, and we all need to be staying 6 feet away from each other whenever possible. So Karen Hantmaker is leading our contact tracing efforts. Karen, contact tracing is underway, so please remind us what contact tracing is, why it's important, and please give us an update on our progress.
Thank you, Dr. Moyer, and good morning, everyone. I would love to remind you about contact tracing and what it is. It is something that the health department has been doing for many, many years. It's a standard and important public health practice that's been very successful at stopping the spread of other diseases you're probably familiar with: Ebola, tuberculosis, sexually transmitted diseases, and even diseases like mumps, measles, and Hep A. So with COVID-19, given the scale of this, the prevalence of COVID-19, we need to do contact tracing on a much larger scale. The purpose of contact tracing is to help people with COVID-19 and the people that they have recently spent time with. When people can safely isolate and recover at home, it definitely prevents the spreading of the virus to others. So successful contact tracing is one of the key tactics that helps us reopen our economy and keep it open. So here are some things about it. Testing for COVID-19 identifies the people who are positive. We then ask people who are positive to tell us who they have had recent close contact with, such as their family members, their friends, coworkers, and then we reach out to them to let them know that they've been exposed and give them the information they need to stay safely at home. So that's the beginning of contact tracing, is identifying the contacts of those who have tested positive. Another thing I want to tell you is that something that people might not realize. We don't just call people and end the call after we give them information about how to take care of themselves. We actually call everybody who has a confirmed case of COVID-19 or confirmed contact. We call them every single day for up to 14 days to see how they feel, to see what help they need for medical care or other essential services. This makes sure that everybody has someone to talk to about how they're doing and to let us know something that we might be able to help them with. Also want to remind everybody that contact tracing, like testing, is private and confidential. The information that you or others provide to us is not shared with law enforcement agencies. Its sole purpose is for individual and public health and to protect people from the spread of COVID-19. So here, I want to tell you about going live last Friday, June 12th, with Lacuna Health for contact tracing. Lacuna Health is a local company, and we are thrilled to be working with them. Last week, the first wave of 25 people was trained on all things about contact tracing. It's a rigorous 4.5-day training, and that training includes being able to use the state's contact tracing and tracking system that we call CTT that Ray referred to. The team started reaching out to new people with COVID-19 and their contacts, as well as those who are already at home recovering and quarantining. This week, a second class of 20 contact tracers is being trained and will finish their training today and will start making calls tomorrow, June 19th. As of today, Lacuna has hired 50 people for these roles. They are continuing to hire and train people until we have enough team members for our whole community, which could be, as of our best estimates now, 80 to 100 people altogether. If you could put the graphic up, Amanda, that would be great. Because I want to tell you a little bit about the people that we've hired. Okay, here we go. So as I mentioned, we've hired 50 to date, and this group is continuing to grow. We are really pleased with the strong diversity in terms of ethnicity and the languages that they speak, because our ability to empathize and engage people who we're calling will be heavily dependent on the individuals that we call being able to relate in some fashion to the people who are calling them. We are really impressed with the very strong professional qualifications that people who have applied for these jobs and have gotten them have. Nearly 3/4 have public health, social work, or healthcare degrees and backgrounds. It is extremely impressive and important to the success of our program. As of this moment, 20 people are from Louisville and live here, and over half are from Kentucky. And as we continue to hire, we are deliberately and actively prioritizing people who live here. And as we are still taking applications, please apply if you are from here and want to make a difference in people's lives and the community. Further, I want to let everybody know that we have a unique caller ID specific to this program. It is called Lou Health, Louhealth, and this will show up on your caller ID with a 502 area code. When you see that, please know it's one of our contact tracers calling to provide you with the information you need to protect yourself, your family, and to help stop COVID-19 from spreading. If we don't reach you right away, we will leave voicemails and a specific number for you to call back so you can reach somebody with very readily. And we will continue to keep trying if we don't hear from you. It's that important. And in upcoming briefings on contact tracing, I'm going to continue to give you numbers about how we're doing with COVID-19, of course, just like the rest of the team, but we will also tell you more about the real people behind these numbers. We want to tell you more about the people who are doing the contact tracing and why they apply for these important positions. I think you'll be very impressed with the passion and the purpose that people have come to these jobs with. And we will also tell you about people who have received calls from our contact tracers and their experience. All of this is to help personalize it, make it real, make people really understand the value and the importance and the essence of what we are trying to do to help our community as much as possible. And in the meantime, please do spread the word about Lou Health. Please answer if we call. It's a very important step for all of us to take to spread the stop of COVID-19 and keep our economy open and thriving. I'm happy to take questions at any point. Thank you.
Thanks, Karen. Another great reminder that we're just starting to ramp up our response to COVID. So everyone keep going slow as you get back to your new normal. Please keep your contacts low so our team can reach everyone you've had close contact with. Keeping track of it on your phone or wherever is easy for you to remember is another really important thing to be doing. So every time we go out, we need to assess our risks for contracting COVID-19 and bringing it back to our loved ones. With that, I don't see any questions yet in the chat box. So I know, hey Nick, pools are opening on June 29th, and I know there's some new guidance coming out for that. Do you want to take a moment to just go over pools with the community for us?
I am more than happy to, Dr. Moyer. Thank you for letting me know. As Dr. Moyer mentioned, pools are set to open on June 29th. And this guidance was issued and recently posted on the governor's Healthy at Work website. For all businesses, including pools, I highly suggest that you are checking in frequently with this website. This guidance is going to be in addition to the existing guidance that's already been released for aquatic centers that was effective on June 1st. That can also be found at the Healthy at Work website. And it gives those general directions that allows the leisure and entertainment activities at pools. So the guidance continues to require employers and employees to implement the Healthy at Work minimum requirements. And these are those general safety guidelines that we've all become used to, such as social distancing, cleaning requirements, wearing masks, and so on and so forth. Swimming pools must be limited to the occupancy of the square footage of the pool as well as the facility to make sure that we can still facilitate that 6 feet of distance between all people visiting the facility. Also, pools that offer other services must follow that specific service document. So if that pool offers food, it offers any type of retails or gym, that pool operator needs to make sure they're going to the Healthy at Work website and following those directions. So last, I want to make sure that all pools know that they must be up and current on their licensing fees. And then also, here's the kickers, that they also have to receive a Healthy at Work COVID inspection before they can open. So that brings in 2 logistics things. Number one, because of all businesses are working at lower in-office staffing capacity, the best way for pools to pay their fees is to get online. And so it's very simple. Go to your louisvilleky.gov website, get to the search box and just type in pay a permit, and it'll take you to the health department's webpage to pay that permit. if you call, we are receiving a lot of calls for lifeguards as well as other facilities trying to get permits in, and just know we just received this guidance yesterday. So we've got a little over or just under 2 weeks to get 500 plus pools open. So please go online, make sure your permit is paid, and then we will be posting information shortly about how to schedule that COVID inspection so that each one of these pools can get opened up. So other than that, if you have any questions, I can answer them now. Also, we will be posting more information on our website.
Hey, Nick, I have a question for you. Not necessarily a question, but I heard you make a great point not too long ago that you encouraged everyone to check the Healthy at Work guidelines for the various businesses or places that we're going so that we know, we as consumers and patrons of businesses know what's expected of them. And then, can you just share a little more about that? I thought that was really helpful. And then what people can do if they don't observe the businesses following the Healthy at Work guidelines.
I'm glad you caught on that, Kathy. I snuck that in there hoping that somebody would ask a question. So, the governor's team keeps opening up more and more businesses every day, right? And those guidance documents are also updated. So it could include fewer restrictions or more, fewer safeguards or more safeguards depending on the business. So it's first off the business's responsibility to know what that guidance is and to implement those safeguards. The next thing, as conscious consumers and customers and residents of Kentucky, it's our responsibility to also know what those safeguards are so that when we go into businesses, we're able to notice, are they following the same safeguards? And then two, are they requiring the other customers to follow those safeguards? Because when we go and visit these businesses that aren't, we're increasing our risk of exposure more and more, especially in some of these larger businesses or when we go to larger gatherings, right? So if that does occur and you do witness businesses not following the safety guidelines issued by the governor and through the state or on the Healthy at Work website, one of the best ways to get a hold of us is to go to the 311 complaint website where you can email in a question or ask for assistance or ask us to go and visit that business, all right? I know 311 gets a lot of phone calls, but if you email that in, you don't have to wait on the phone. We're not going to drop your call, and we are constantly going back and looking at those emails to make sure they get put into the system. So 311 will answer that email. They'll shoot it over to the health department, and we'll either call or visit that business in person to talk to them and coach them into those right compliance measures.
Thanks, Nick. Great information for everyone to know. So we do have some control if you're following businesses or if you're going to businesses that don't seem to be following the rules, please let us know. So email 311 is the best, but they do take phone calls, they do take tweets, so whatever you want to reach them, but please just let us know. So we do have a few questions now. One is, how many people have been contacted during the contact tracing program thus far, and how many have been reached? What are the benchmarks that would signify that it's a success? Karen, do you mind answering that question for us?
I'm happy to, Dr. Moyer. This is a really great question, and in subsequent briefings, we'll be sharing with you data such as how we are doing with reaching people and what challenges we are having and how many people we have contacted, and giving you some indicators of how the program is doing. And at this point in time, the ultimate benchmark is going to be reducing the spread. And in the EpiCurve that Ray showed, you saw that we are starting to have fewer hospitalizations. That is a good sign. But if cases continue to rise and we see hospitalizations increasing, that will in part be a reflection of our contact tracing effort not being as good as we thought. So we need to definitely keep tabs on those numbers. But underneath all of that is absolutely the success that we have reaching everybody. So our communications effort, the way that people respond to the calls, and our continuing daily monitoring and reaching out to people who are already isolating and quarantining is essential. So stay tuned, because we are definitely going to be providing more information on numbers like you're requesting and the benchmarks that would show how we are doing.
Thanks, Karen. We have one more question related to contact tracers, and it's just asking, what about people who don't cooperate with contact tracers? So I'll give a partial answer, and then Karen, if you want to add anything. So just as public health, just really believe that most people do want to keep their families, friends, and communities safe and will cooperate with us. If we can determine who someone may have exposed, then our only if we can't determine who they might have exposed, our only other option is to broadcast broadly to the public. And that's really a last option, because it's not ideal and can really feed into fear and anxiety. But if we can get the information we need from people about who they've been in contact with, and we can contact them, then that's the best way that we can prevent the spread of COVID in the community. So just really can't emphasize enough that we all can be safer and limit our exposure by wearing a mask when we go out, not touching our faces, washing our hands, staying 6 feet apart from each other, and then cooperating with contact tracing. So just hoping people will follow that. And I just believe that people have the best interests of their family and friends and community at heart. So Karen, anything else to add?
Yes, I would just like to say that if people refuse to cooperate, we will respect that, but we will do our best with the empathetic training and conversations that our contact tracers will have and try to have with individuals. So maybe if they could get to the root of what they're worried about, is it a pure privacy concern? We can address that. If it is they're afraid of missing work, we can work with them to address that issue and how to talk to their employer. We can talk to them about their concerns for taking care of children, or their maybe their older parents, or other responsibilities they have that might prevent them from quarantining or isolating. So we can do our best to work through the issues that might be holding them back. So we're not going to just take no for an answer right away. We're going to be respectful and try to engage people and understand what it is that might be holding them back from participating in taking care of themselves in the best possible way.
Thanks, Karen. And then we've gotten a few questions on Facebook as well. So Ray, I think this one, looking to you to help answer. Can you tell us why the COVID-19 website has a different number than we do here in Louisville with our case counts?
Yes. So there's a difference between our case counts, namely because generally speaking, we're the ones who get the reports first and we put them in, and depending on when we pull this information and decide to cut off the data for reporting purposes, that could very well be part of the reason for why there's a difference. And generally speaking, we find out about things before we report them to the state or have a chance to report them to the state. And so that could explain some of the differences that we're currently observing between our numbers and their numbers. But we're working on reconciling the two and at least bringing them more in line with each other.
Thanks, Ray. And then the zip code map we shared, and hopefully we'll be able to keep sharing that information going forward. That was another question from the Facebook as well too. And then the last question I see is there an update on the test results for people who have participated in protests? So what I can answer there is the question, have you participated in a protest, is not something that's on our lab intake form. And so anything that I can share about that before the whole contact tracing process happens would not be accurate. And so just really encourage people that if they've been in large crowds, been in anywhere around someone who's tested positive, that they go and get tested. You can look at our website for all the most up-to-date information of the testing. And then as Karen mentioned, we work as hard as we can to contact those people that were close contacts directly. And only as a last resort do we release that information to the public if the public needs to know because they're in a place where we weren't able to contact them directly. And so just trying to protect public health information, also make sure people feel safe getting tested, that we're not sharing anything to the public, and it's not one of the questions on the lab form. So don't have information there, but you can see the numbers reflected in our last week of people who've tested, and so just assume, keep getting the message out that being tested is really important. And that's how we're going to help stop the spread of COVID. So I don't see any more questions. And so I guess with that, just really appreciate everybody tuning in. And there's someone who wanted to say something. Just feedback. All right, well, thank you. And next week, Dr. Moya will be here hosting the press briefing. And so looking forward to sharing more information and talking to you all then. Thank you.